Iliotibial Band Syndrome, or IT Band Syndrome, unfortunately is quite common in repetitive type sports. So things like running and cycling, where we're doing a lot of knee flexion and extension over and over again. The issue is friction around the IT band, which runs from down from our hip on the outside of our leg across the side of the knee, and it attaches onto the tuberosity just here. We tend to get the pain anywhere around that area. So if I was to move my knee there, that's where the extra frictions occur. If I straighten my leg like that, you can just see my IT band, which is that bit there. On most people, you can feel the band. A lot of people will say, oh, my IT band is too tight, which is why they're getting problems, which isn't strictly true. The IT band is tenderness, it's not a muscle, and it's meant to be tight. It stabilizes the knee. The issue comes more from the hip, so things like glute maximus and TFL, which is where the IT band originates from. So for this rehab program, this is where we're going to focus. You can apply ice directly to the area of pain because it's inflammation and irritation that will help, but the prevention or treatment for this injury is up in the glutes. So what we're going to do, I'm going to be swapping legs on this purely for the camera. So in this case, my left knee is going to be the problem. So I'm going to stretch in the left glute. So to do that, I'm going to sit with my legs out in front of me, and I'm going to bring my left leg up and over so it sits on the outside of my right knee. And then I'm going to cuddle my left knee in towards my chest. I'm going to go directly towards the sternum first, or the middle of my chest. And then I'm going to use my left hand just to push my knee further across to the opposite shoulder, so the right shoulder in this case. And I'm feeling this stretch deep in the muscle just here. And then just relax off and then squeeze and push again. You can also twist your body round just to get that stretch higher up into the hip. From there, I'm then going to go into hip rotations. So I'm going to bring my knees up, and then I'm just going to drop my legs down. So my right hip is in internal, and my left hip is in external rotation. Do this on both, the better stretch. So again, if my left leg is the issue leg, the better stretch is going to be that one. So the internal rotation, and I feel that up my IT band, and I feel it on my TFL and a little bit on my glute. This leg is pointing straight out in front of me, so try to make sure that is the case. So you've got a direct line in front. And again, just swap over, so you're going through internal and external rotation. The muscles that run across your glutes do rotation of your hips. So by doing this movement, you're getting them to relax off. From there, and this is where I'm going to swap legs. So now I'm going to be stretching my right leg. Obviously, you would do this the other way if it's your left leg is the issue. I'm going to lie myself flat onto the floor, and I'm going to come into a standard quad stretch and pull that back round. If that hurts your knee being in so much flexion, if you place some towels behind your knee and then pull it back round a little bit further, just so you're not flexing your knee as much. Once I'm in that position, I'm then just going to bring my left leg up and over and use that to push my knee down towards the floor. And by doing that, I feel the stretch move higher up towards my hip. Relax off, straighten, and then pull back in. So again, into glute stretch, pull it back round, and then use that left leg to push it down towards the floor. I'm then going to start to try and activate my glutes. So to do this, I'm going to go again with my knees up, and I'm going to go into a glute bridge. You can do this banded, so you can band around your knees. You want to push out with your knees and push up, and really squeeze your glutes when you get to the top and relax back down. And you're trying to get your body in a straight line when you push up, so you don't want your hips to be drooping down. So squeeze out with your knees and push up and relax down. You can also, if you bring your feet together and drop your knees down, you can then squeeze up from there as well. And that's a nice variation of glute bridge. From there, I'm then going to go onto all fours, and same sort of thing. So I'm looking to activate my glutes. So again, I'll just show you on the left-hand side if that is the problem side. To start with, I'm going to go into glute extension. So a hip extension is the movement that the glute does. So keep my core nice and tight, and just squeeze back up with my leg, and you should feel a nice big squeeze in your glute. You shouldn't feel too much in your hamstring and lower back. It should be quite glute dominant. And try and keep your core tight throughout. And then go back into neutral, and then I'm also going to go into glute abduction to get the glute med to work as well. So to do this, my glute are going to go straight out to the side with my knee, and then back to neutral, and out again. And back to neutral. And then the final one I'm going to do is going to combine the two. So I want to go out and back round, and almost create like a circular motion with your knee. And that gets your glute meds and your glute max and your TFL all firing at the same time. Again, try and keep your core quite tight throughout, so you're just trying to move your hip. And then back into neutral. If you try and do those exercises every other day initially, and then progressing to every day, that will really help with your knee. Do try and avoid repetitive injuries. Anything that hurts your knee, try and avoid. And if you have to do anything, definitely try and get some ice on straight away afterwards to get that inflammation down. Stick with those exercises, a little bit of stretching, a little bit of strengthening in there, and that will overcome your IT band syndrome. Hope that video helps. Any feedback, please do let us know.